PARP inhibitors are a very effective new form of therapy, particularly for ovarian cancer, but other cancers as well. And in ovarian cancer, we have now 3 PARP inhibitors that are approved. So they're increasingly being used for women who have ovarian cancer. They're particularly effective for women who have BRCA mutations, but they're also effective for other ovarian cancers as well. So we're spending a lot of time trying to identify who will benefit from the PARP inhibitors, but now that we're treating more people, we're seeing development of resistance. And for cancers that are predicted to be sensitive, we're trying to figure out what are the mechanisms of resistance, because that will help us treat those women better. One of the things that makes PARP inhibitors effective is that the cancers have defects in a type of DNA repair called homologous recombination. So one of the ways the cancers get around the PARP inhibitors is they restore that DNA repair. So initially they can't fix double-strand DNA breaks well, but then they develop mechanisms that make them able to restore DNA repair and repair those double-strand DNA breaks, and that goes along with resistance to the PARP inhibitors. We are getting better at doing that. We're certainly getting better at predicting who will initially respond. We're just now learning what are the predictors of resistance, which is not exactly the same as the predictors of response, and it's not always exactly the opposite either. They're a little bit more devious, the mechanisms that cancers acquire. Another problem is that cancers are very heterogeneous. Not every cancer cell is like the one next to it. And so some cancer cells are picking up different types of resistance to the PARP inhibitors. So that heterogeneity is a big problem in cancer resistance right now, in general. They develop more heterogeneity as the cancer progresses and during multiple lines of different kinds of treatment. So one of the things is to move these treatments earlier into the disease course. And right now, PARP inhibitors are being studied in ovarian cancer in the primary setting of therapy, where the cancers hopefully are less heterogeneous and may have less ability to develop resistance. One future direction for PARP inhibitors is combining them with other therapies. It hasn't been very easy to combine PARP inhibitors with traditional chemotherapy because they both have quite a lot of toxicity on the bone marrow, and those toxicities add up too much to combine them effectively at the right doses. But it's looking very promising to combine PARP inhibitors with other novel therapies, including drugs that battle angiogenesis and drugs in the immuno-oncology field. So there's synergy between how the PARP inhibitors work and how some of these other targeted drugs work that can make them both be more effective used together. I think we're still in the early stages, but whenever we combine 2 different drugs that work in different ways, we're killing more cells at the same time and inhibiting the development of resistance. But the synergy between the 2 can overcome some types of resistance. Yeah, I think right now there are new drugs that are coming out that increase the DNA repair defects in the cancer, which then sensitizes the cancers to the PARP inhibitors. So those combinations are particularly attractive. There's a number of combinations that are still in preclinical development, meaning they're being tested in mice, but there's a number of these combinations that are in phase 1 and phase 2 trials. And the combination of PARP inhibitors with the immune checkpoint inhibitors are actually now even in phase 3 trials. One of the most common resistance mechanisms that cancers that have BRCA mutations, so these cancers, they can be germline mutations, meaning the patient has inherited a mutation from their mother or their father, and now it's in all the cancer cells, or it could be a somatic mutation where just the tumor has that mutation. But either way, it sensitizes the cancer to the PARP inhibitors. So one of the most common mechanisms of resistance is that it reverses that mutation. So it either develops another mutation in the tumor that basically cancels out the initial mutation and allows the BRCA1 or BRCA2 to re-express itself. And then that is the mechanism of resistance. The one thing that's really important is that it is the standard of care to test all women with ovarian cancer for hereditary predisposition, including BRCA1 and BRCA2 mutations, but we're doing a terrible job of that clinically. And now it's really important for women to understand that, both for 2 reasons. One, for their family who may be at risk for breast and ovarian cancer or prostate cancer. And so family members need to know that. But additionally, right now these drugs are really effective therapies for these women, and it's important that we identify these mutations in patients so they can get access to these drugs.